Hello, hello. Welcome back to I Wish I Knew a Nurse. This series is being done. My name is Casey Pacheco, and I have my co-host. A she is a certified case manager, and her name is Sandy Dingler. Welcome, Sandy, to our show.
Well, thank you. I just love having this so that we can share information to help people stay out of the hospital, even.
Absolutely, absolutely. And today we're going to be talking to our viewers about preparing for a doctor's appointment. So, most people, when it comes to a doctor's appointment, they don't think about preparing. They just think about, do I know where I need to go and
Yeah.
what time,
How do
right?
I get there? What time do I need to get there?
Yes. So you're going to share some gems with us, Sandy. You've been a home health nurse for a very long time, and you really help patients and their family members to prepare to have an effective doctor's appointment. And just really quickly, what would you describe as an effective doctor's appointment?
Where the patient is getting what they want to achieve. They they feel like they had their needs met and their goals met when
Mm.
so that's very big, uh,
Yes, it is.
and save the doctor time. Uh,
Yes. It's true because some of these appointments are like 15 minutes and you've been waiting for 2 hours, 15 minutes, you feel rushed, and half of what you wanted to say or you need it done, you have to be calling after, and then you can't even get a hold of them.
that's right. So the biggest thing is think about it and prepare and write it down and ask a question. Be prepared uh,
Hmm.
for your appointment.
Yes, and as we were preparing for this, you even mentioned about like not just writing down random questions, but being very specific in the
That's
question,
right.
right? So you were saying like not an open-ended question. So can you give us an example of what an open-ended question is versus a specific question?
Yes. So if the doctor says, well, we'll just continue to watch it, or if you say, thank you, and when is my next appointment, that's not a specific question. For instance, if you've been ordered along that line, then what's the purpose of the test? Um, what do you hope to accomplish with it?
Okay, we lost you there for a little bit. We lost your video, but I
Oh,
can still hear
um,
your audio.
oh,
Okay. So could you just repeat? So you were saying if they you want to ask them, what do you expect this medication to accomplish? That's like a specific question.
exactly.
I
Yeah.
really like that.
How
I
will
really
you know that it's working?
How will you know this medication is working? That's another specific question.
Yeah. And
Very good.
how will you uh, test to make sure that it's working?
How would you test to make sure this medication is working? These are very empowering questions.
Yeah. Empowerment, that's and confidence, that's how you have a doctor's appointment. It's a
Mm,
professional meeting where the patient needs to let their needs be known
okay.
so that
And
they need.
yeah, what you have to tell them what they need. And I really like how you say, make sure you have that pen and paper and that you were writing this before. You didn't just wait, and to think about it during the visit, but before you even get to the office, you're writing it down.
That's right. And
Mm-hmm.
so the doctor examines, and the doctor usually says, do you have any questions? Or, yes, I do.
Mm-hmm.
And say,
Yes.
since a patient wants to get off of some medications, That's when how do I go about that? What plan can we make together? So that's very empowering. And it really helps with the appointment. Make sure you take everything with you, all your medications and
Okay.
supplements that you take, and make sure your records are correct. Make sure they update everything while you're
Okay.
there.
Okay. That's important to know. So make sure you're taking all your medications. If you're taking any supplements, it wouldn't hurt to take those as well, because just in case any major interactions. And
Yes.
then also make sure that they're actually updating it. I like that, Sandy.
Yeah. So uh, that is really the bulk of it. But if your goal is to get off of some medications, that's when you mention that.
Mm,
Term is called de-prescribing now. It's all over everywhere. That's the latest term to use. I want to get off, be on as few medications as I can. How can we make that happen, doctor?
Oh, Sandy, that is beautiful. I love the language that you're using, because sometimes I think the physicians, with Google and just all this information, abundance of information, sometimes I think the patient's language can come across where it kind of rubs the doctor, and then you have like you have this tussle. But when you say, how can we make a plan, how can we get off of this, it's more collaborative.
Exactly. And all of a sudden, your doctor will start smiling and be excited, and let's make a plan.
I love it. And I think that really speaks a lot to what is called patient-centered care, where it's where you recognize that the purpose of the visit really is for the patient, but not for the patient to demand or bully
That
the provider.
it's collaboration. You
Collaboration.
cannot go wrong doing that.
Yes, and a lot of times is really using words such as we and us, and what can, I really like that, the terminology that you're using, Sandy.
Oh, thank you. And
Mhm,
that really helps with that relationship.
mhm.
And that's what you need to have great health care.
Now, I have a question for you, Sandy. As you talk about relationship, and a lot of patients, they are really like in a more of a holistic or functional style. So, what would you say if that patient is talking with the doctor and they are not meeting on the same page? The doctor thinks one course is good and the patient is like, no. How do you think, what are some things they can do to bridge the gap to really have that patient-centered care?
Well, again, having it written down with what they want,
Mhm,
keeping up with the records
mhm.
and their diagnoses and what their plan is. I mean, it's all about choice.
Yeah,
So,
choice.
if you have a doctor that is not listening,
Mhm,
you might need to check around for a different doctor.
mhm,
It's hard, it's difficult, of course.
mhm.
But if your doctor is not meeting your needs for whatever reason, then maybe it's time to find a different one.
Mhm, mhm. And Sandy, I'm just gonna flash back to our last episode. Last time we were on, you talked about when you were leaving an appointment, you should really ask for your records of that appointment that day. So that will, if you're thinking, we didn't really see eye to eye, and I want a second opinion, it wouldn't hurt to take the visit that you didn't see eye to eye to another provider so that they can see, and they can see what the doctor is looking at in terms of lab values, in terms of your vital signs, in terms of your past medical history, so that you're not just biasly going to get a second opinion for someone just to agree with you, but you can have a true second opinion by having the notes from your previous provider. What do you think about that, Sandy?
You have really brought up a big point. Because of privacy laws,
Mhm.
the patient has to direct the facility or lab or doctor's office to share records. Back in the day, it used to be automatic. It is not.
Mhm.
So, um, say you are going to a specialist. When you call or they call you and verify that appointment, you should go ahead and ask, do you have my records from Dr. Smith or whatever?
Mhm.
Make sure they have them. And how you can make your way around that, because it happens all the time,
Mhm.
is you can get your records after each appointment. If you were in the hospital or had a test done, get those records. You are entitled to them by law. Get
Mhm.
a copy of those records. And when you do it, when you're leaving the appointment, they uh, don't charge you for them. They just print them right off.
Yes. And Sandy, in the home health space, something that I have seen is that sometimes we're getting um the same tests from many providers because apparently the patient wants a second opinion or third or fourth, and you're getting all these, and obviously none of these providers are even aware of each other, and they're all ordering duplicate, triplicate labs on the same patient. So I think really for the patient or their caregiver, if you are going to get a second opinion or third, really being having those documents with you so that
Yeah,
you're not bombarded with the same information.
exactly right. So this is really patient in the past, probably 30, 40 years ago. We would just go to the doctor and they would take care of everything.
Yes.
These days, with all the technology and everyone is so overwhelmed with things and the coordination, we want to make sure the patient and their family really needs to make sure everything is there.
Hmm. And you reiterated about asking for a copy of their visit before they leave. Something that you also mentioned was even before, like before they get to the hospital, or especially if it's a facility, because at a doctor's office, if you ask for your record, you're going to get it right away. But if you're at the hospital or a nursing home, those notes may take a day, two, a week, to actually be provided to you. So even when before you leave, you can let the provider know, I will be requesting my records on discharge. So they will know that, hey, first of all, you need to have your records typed up and ready to go. But second of all, that you are an involved patient. You really care about the care that you're going to get.
Yes.
What's your thought on that, Sandy?
Oh, that's exactly right. And if you need help understanding what's in the records, ask for help.
Mm-hmm.
With, you might have somebody in your family,
Mm-hmm.
or I'm certainly willing to read through them with you. I've
Mm-hmm.
since 2008. And so we can, there's people to help you understand the records.
Mm-hmm. Absolutely. You bring up a really good point. getting someone, if you have someone in your family that can help you understand what's in the records, that is definitely something that you want to do, ask for help. But even seeking out professional help while you're in the hospital, or the facility, they may have a case manager or social worker, but they just may not have time. So Sandy, I think you have really good prices, price structure. If a patient does want help, especially if it's something that it can, save money or get some money back, I definitely think reaching out to you would be a really good option for them. And something you mentioned while we were preparing for this, you said that when a patient has a complaint, and they call whoever they call about the services that was provided or not provided, you mentioned this, and I'm going to really slow down for this because I thought this was gold. You said it is not how you felt about how you were treated or cared about, but it was what is documented. You have to prove by in the records about something that you think was not done. The paperwork has to match. Did I say that correctly or did I just butcher it?
No, you are exactly right. And especially if somebody has Medicare or Medicare Advantage, and they both types. Medicare is um, uh, publicly funded, it's not for profit. Medicare Advantage is for profit, and but they both follow the same laws. They're very easy to find. And so, anyway, Medicare is federal. There is, you just go right to the federal site and it says, I want to make a complaint, and you just click on it.
Okay.
It used to be hard, and in the
Mhm.
2 years, it's no longer hard to find it at all.
Okay. And Sandy, this is like, I remember being in the hospital and you have those family members and they come and they're asking, what's your name? What's your title? And you see them, they're writing down everything. And sometimes I really can blame them, but I think there is a way to do it. I think there's a way to record from a family member or a patient's perspective that really reflects not that you are waiting or expecting them to mess up, but more so that you are diligent in the care that you are providing and that you're taking. And it's actually commendable when someone comes in and they know you can look at their notes better than the last nurse on the shift, that's really commendable. But I think there's a way to do it. What's your thoughts on that, Sandy?
Well, I'm just thinking back to kind of a funny story. I
Uh-huh.
I was at someone's home, and somebody was trying to sort of off in the corner, sort of look up things on the internet, everything that we were going over about disease and all that. And I said, here, let's do that together. Let's look it up together. And it
Yeah.
did exactly that. And all of a sudden, we had um, people collaborating together to find out about this disease process and make a plan. That's
Mhm.
the right way to do things.
I love it. I love it because Sandy, you always come from such a mature space where just really involving collaboration. And if we do see the family members writing and we feel intimidated, maybe
Then
we can,
train them.
yeah, we can go work with them. Let me see what you're doing.
Fine.
Let me tell you the medication that I'm giving,
Mhm.
um let me talk to you about what the plan is, and then maybe even that might even be a good way to follow up and say, did we meet the plan? Did we check off all the boxes on your list? Not all the times you can meet everyone's demand, every single demand that they have, but I really like what you're talking about, that collaborative tone and perspective that you're talking about.
Exactly right. And so that's how we collaborate, coordinate care, work together with facilities, and make sure the doctors have that information. In a
Mhm.
facility, that's how you get information to the doctors. They're in charge of your case. So if there's something being worried about, that's how you do it. Go to a case conference. They have them every week. That's how you get the care that you need done.
Mhm, mhm. And I think even, because a lot of nursing homes and, hospitals, they really try to give you a care team consisting of your doctor, your nurse, your assistant, your case manager, which might be a nurse or a social worker, your physical therapist. So you usually know who's on your team, and having that documented or knowing who's on your team, from admit all the way to discharge can be helpful.
Exactly right. So
Mhm.
have it again. Taking notes on the phone,
Yeah.
in a notebook. Uh, that's what you need to have so that you can keep up with it.
You know, before the last thing before we move to our final topic is I want to say a note on taking notes because sometimes during the appointment you may need to start your note taking because they may want for the appointment that you're going to, especially if it's like a specialist, you may have certain labs that you need to take for follow up. You may have the appointment might be a review of some imaging studies or another referral that you got sent to. So when you're making an appointment, you really should write down or ask, is there anything that we will need for this appointment that I need to bring? Do you need to bring the labs? Did they get the labs? Did they get the referrals? Because you don't want to go to an appointment and then they didn't get the labs. So you just wasted all of your time, or they never got the referral letter. So now you're speaking for the doctor and you don't really know what his thoughts were. Have you seen that, Sandy? Did I lose you? I think I lost her. The last one, let's see if she pops back in. Let's see. A little bit of technical difficulties, but hopefully she will come back in. Um, I'll ask her that when she comes back in. But the last one that Sandy talked about was finding an advocate, particularly someone competent to speak in your behalf, hopefully a younger person, and giving knowledge of like some people they don't want other people. Oh, there she is. Okay, Sandy, you're back on.
What
Let me add you.
happened? It said internet
Here
went.
you are. We have video and everything. So let me go back. Let me go back. I was talking about um on taking notes, I was just saying that sometimes in taking notes, it needs to start before the appointment because when you're calling to make the appointment, especially if it is to a specialist, you want to make sure that they have what they need. So you want to ask, for before you go to the appointment, did they get the labs? Did they get the imaging studies? Did they get the referral letter from the previous doctor? Because you don't want to go there and then you had no you had there was no reason for you to go because they didn't get anything and you just wasted your whole day.
Well, not only that, you'll be billed for that appointment
Mm,
that might not meet your needs.
mm. That's
So,
true. That's
yeah.
true. That is very true. So making your notes Start it early from the time before you even get to the appointment. Make sure that you have everything that you need, and that they have everything that they need. You can't take it for granted that they know that it's for labs. Sometimes it gets lost in translation. Okay, Sandy. Before you go out again, let's get to our last point.
Okay.
When you show up for a doctor's appointment, right? It is important to have an advocate, either there with you or someone who knows what's going on.
Exactly. Because you can be overwhelmed by everything, the examination and all those things. So it's good to have someone with you.
Mhm. Sandy, what would you say for people whose um they don't they're very private, so they don't even want to tell their kids what's going on, or maybe their kids are not, like, in their eyes or in reality deemed responsible to handle their sensitive medical information, or they just don't want them to know about it. What would you advise them? Because somebody has to know what's going on. What would your recommendations be?
I would advise that they might want to consider speaking to a nurse advocate. Uh,
Ooh.
a nurse advocate, and I've done this many times over the years,
Mhm.
they're at the doctor's appointment, for instance, and they said, I'd like to call my nurse advocate and I'm giving permission. And
Mm.
that works very well. Uh,
Okay.
have a question. I've done it at people's homes. And lots of nurse advocates do that.
That's
So,
true.
yeah, we help people out, help them. It's another two heads are better than one kind of thing.
Yes, yes, yes. And I think that's a really wise suggestion, even for some, what I have seen, especially in home health, you get real personal with the patients. And sometimes, for some reason, whether it's substance abuse or just mismanagement of funds, that person does not want their family member, who is their only person to speak in their behalf, to have access. So having a nurse advocate would serve a twofold reason, because if anything ever happened to them, now, if in a critical situation, there's someone to explain to the family what's going on when it's time to make a decision, that's guiding them and has been there all along. Does that make sense?
Exactly right. And like even on my living will, I have other persons besides family that
Mm,
I have trusted with some information. I even have it on there. So
okay.
one else could have access to my information.
Now, I know we're on the East Coast, but do you know around because a lot of seniors, they have very tight budgets, not all of them, but some of them do. Are
Most
what what is the cost? Because sometimes we say this and it sounds like really sorry. It sounds like really, like, expensive. And so people sometimes, they just dismiss it because they're like, I could never afford to have a nurse, advocate. It might sound like really beyond them. What is the price range of a nurse advocate? What have you seen?
well, I've seen a variety of. It just depends on what somebody is wanting. If
Mhm.
it's just a phone call, it might be $50,
Mhm.
or it just depends on what it is. And
Yeah.
so the thing to do is to work that out with whomever you're speaking with.
Mhm.
Like for myself, first I just speak with them on the phone and we work something out. And as far as price goes and what the goals are. It
Yeah.
might be they want to know about a disease process. It
Mhm.
might be that they want some help with an insurance denial.
Mhm.
It just depends on what it is. And
Yes.
so all the nurse advocates that I know do it according to what the patient needs,
Yes.
wants. They work it out.
Yes. And Sandy, as you're helping me build this alternate community model of care, and you're one of my chief case managers, I think as we spread throughout the United States and we have these case managers in the community who our clients can talk to, I think for them knowing that we're here really to work for them and we're not working for the agency or for the insurance company, but we're for them and that we want them to succeed, it would make them feel easy to reach out to Preservers of Life, to reach out to Sandra's Consulting,
Mhm.
to get someone to help them because our healthcare system is not getting any easier to navigate.
No,
And
it's not.
yeah, yeah. So I think that's definitely the fact that we will talk to them, figure out how can we help them, and if if they are absolutely like cash strapped and unable to pay for a private session, something that we can do is we can give them a resource because there are resources in the community where most times they would qualify for maybe if they have home health and they need a social worker to come explain certain things to them.
Yeah, yeah,
So reaching out to us is going to work for them either way, whether they become a client of ours or we give them a resource in the community.
that's right, because Medicare pays for home health as long as there's a skilled goal to meet. So that their doctor could order home health and include a social worker or someone else to help with some financial difficulties as well. So
Absolutely.
you and I have both seen that over the years. I've worked all over the country, and
Mhm.
it is the same pretty much everywhere.
Yes, yes, yes. You've been both on the West Coast and the
Mhm.
East Coast. So,
Yeah.
and I haven't seen anybody who knows Medicare laws more than you. I haven't met them. So, I think definitely this is a good resource, and we are providing our services as a value to our communities because we are just foreseeing what's about to happen with the baby boomers, with the nursing shortage, and we just want to empower our community members out there so that they can know that there are resources here for you.
There you go. I
Okay.
think that's just wonderful, and let's make it work.
Let's make it work. Well, Sandy, this was such a wonderful, wonderful, and I always enjoy you. I always enjoy being with
I
you.
enjoy you too. I mean, we it's just amazing. We met just uh, by accident, and
Yes,
we collaborating ever since.
I think it's a divine connection, and hopefully, to the viewers out there, hopefully it's bringing them so much value. And if there is a particular topic you would like to be discussed, or a particular sticky situation, don't give us your personal information. You could go to our website for that, www.preserversoflife.com, and I will connect you to Sandra or one of our other case managers. But if there is any particular topic you would like for us to talk in a general forum and just we're not giving you specific advice, just what we have encountered in our nursing experience. We're just sharing. be sure to leave your comments below. And if you have any questions for Sandy, she knows Medicare law, she will go and research it. So feel free to shoot any questions her way in the comment section. I thank you so much, Sandy, for being here with me today. I thank you, audience, for joining us. And I hope you will, if you find value, you will share, like, and comment to our channel. Thank you so much, and you have a wonderful day.
You too.
Thank